Okay. I'm going to give the floor to Dr. Jami Fukui. So she's an assistant professor and clinical translational researcher at the UH Cancer Center. She also is an oncologist at in the HPH system. She has hobbies too, like hiking, singing, yoga, and reading when she's not in these workshops and treating breast cancer patients. So Dr. Jami Fukui, I'm going to give you the floor. Take it away.
Great. Thanks so much for that introduction, Joanne, and thank you everyone for being here. It's really exciting to talk about physical activity and cancer. This is something that's really near and dear to my heart since I do see breast cancer patients, but also through the whole trajectory into survivorship. So if you go to the next slide, I'm going to actually be talking about several different things during this very quick talk, just about cancer and obesity and how those things are related. I'll briefly talk about some risk factors, some things we can change, some things we can't change, but physical activity is one of those things we can. And so I'll talk to you a little bit about our recommendations for physical activity, but then I'll let the experts take it away with that. I'll briefly talk about diet, as well as what we call body mass index. And that has historically been the way that we follow physical activity, body mass index, so our bodies, but that's probably not the best way to follow our body composition. So I'm going to lead right into some studies that we have that are ongoing. So if you look at the next slide, this is a schematic of the, I don't know if it's about ready to show. Yep, it's a schematic of 13 types of cancers that are associated with being overweight or obese. So about 40% of all cancers in the US are associated with obesity and being overweight. And we just know that being obese can increase someone's risk of developing cancer. So if we look from the top to the bottom, there's everything from brain, thyroid, esophageal, breast, which is the specialty I'm currently practicing in, gallbladder, stomach, kidneys, uterus, ovaries, colon, pancreas. So all of these can increase someone's risk for developing this in their lifetime. So it's not just one particular type of cancer. If you go to the next slide, I'm going to show you just a simple schematic of how we think obesity causes cancer. So on the right, you'll see a little schematic of some pink cells. Those are fat cells. What they tend to do is they make hormones and growth factors. And this creates an environment where the cells are stimulated to grow. We call that chronic inflammation. And when those growth factors and hormones stimulate cells to grow, that increases the chance of cancer cells being produced. And so sometimes when those cells are forced to grow under these circumstances, a cancer cell or a mutation will appear, and that will continue to grow and divide and cause a tumor. And so the thought is that fat tissue harbors all of those hormones and growth factors and can be released in the circulation and increase the risk of common cancers such as breast, endometrial, and ovarian. It also produces some low levels of blood levels of insulin and insulin-like growth factor, which can also promote other types of cells from growing, including colon, kidney, prostate, and endometrial, which can lead to cancers. So this is kind of a simple way of how we think about how obesity and cancer, the mechanism of that. If we go to the next slide, I'll actually talk a little bit about some things that we can do that we can change. Unfortunately, we can't change our age or if there's chronic inflammation inside. There have been studies looking at women or men who take anti-inflammatories, and it does show that for whatever reason, if they were to take anti-inflammatories, it does slightly decrease your risk of developing other types of cancers, such as colon and breast and uterine. We're not quite sure how much somebody needs to take, but we do think of it as a protective factor. We can't change the environment that we grew up in, our genetics, what we're born with, and our parents. And some of us have other comorbidities, so other types of issues that can cause immunosuppression, like diabetes. And in the past, some people have been subjected to radiation, and so those are unfortunately things that we can't change. However, we can change our diet, nutrition, our physical activity, alcohol consumption, as well as tobacco use. Infectious agents means viruses, so certain viruses can predispose someone to developing different kinds of cancers, and of course our exposure to sunlight. So if we move on to the next slide, This is going to basically give us a brief overview about some benefits of physical activity. We know it's good for the brain. It reduces anxiety and depression and overall improves sleep and quality of life. So we're looking at studies right now looking at cancer survivors and seeing how physical activity can help overall quality of life from things that might have remained after cancer treatment. We also know in older adults especially, it reduces the risk of fall injuries. So if someone's very active, they have good balance, that's a good way to prevent falls in older patients, older people. It also overall reduces mortality. So this is from any other reason. We know people who exercise live longer, live better lives. It improves overall quality of life for people, especially with those with chronic conditions such as diabetes, cholesterol issues, and high blood pressure. If we go to the next slide, I'm going to briefly talk about the recommendations. So these are kind of guidelines, and I put the 300 minutes in bold because what's recommended is 150 to 300 minutes of moderate to intense physical activity a week, or 75 to 150 minutes of vigorous intensity per week. And so the key thing is about 30 minutes a day is what's recommended, is you don't want to have a limited sedentary behavior lifestyle. So not a lot of sitting around or lying down watching TV. In fact, even if you are sitting for majority of the day in your jobs, it's good to walk around at least every hour, stretch, do some kind of activity that's going to get your heart rate up. Those are some of the recommendations. They're very broad, and you'll be cued into what are some things that we can do in a little bit later. Go ahead and go to the next slide because I'm going to briefly talk about diet. So in general, you want to have your plate as colorful as possible. There's a variety of things from fruits and vegetables. It's not very restrictive. So if you like certain kinds of things, it's good to mix and match. The key thing is to avoid processed red meats, sugar high foods, and highly processed foods. And then reduce or moderate your alcohol intake. So in moderation, we consider that a drink or less a day for women or 2 drinks or less a day for men. Finally, if we go to the next, I'm going to briefly talk about body mass index, which is our measure of body fat based on height and weight. And so if you look at that schematic on the right-hand side, you see there's an ideal height, weight versus height ratio. And that, kind of breaks down to what we consider underweight or versus normal weight to overweight. And if we look at the next slide, actually, that's kind of a crude measurement for how we figure out body. It's probably not the best, and so we're learning in research how to find a better way to look at body composition. So for instance, if we look at an athlete who's very heavy, he has a lot of muscle mass, but not, necessarily as tall, he might look overweight according to the BMI. We also know that it varies according to race. So for certain races, so for Asians, BMI should be a little bit lower than whites because Asians tend to have a lot of visceral fat. And so, again, BMI is not the best measure, but we're learning other ways of how to determine our risk and body composition. We know that subcutaneous fat, so peripheral fat is not as important. It probably doesn't cause a lot of health problems, but the visceral fat in the abdomen is more serious. So if you go to the next slide, I have 2 examples of some trials or studies that are ongoing right now. If you look on the right, we call that the iCare program, the Cancer Exercise Rehabilitation Study. It's at the Rehab Hospital of the Pacific, which is across from Kuakini. And what it is, it's free. It's for any cancer survivor at any time. And it's a 3-month program, 3 times a week. You're partnered with a kinesiology student from UH. They're learning how to do physical therapy. It's like having a personal trainer, one-on-one. It's 90-minute sessions 3 times a week for 3 months. And then you have the opportunity to continue if you like that study for an additional 3 months, twice a week. What they do is a bunch of assessments before and after the first, each session, actually, each 3-month session. And it's a great way to follow and be motivated to exercise. We've utilized the same exercise program at the University of Hawaii Cancer Center. And so we have an ongoing breast cancer specific exercise study. And there we're incorporating body composition. So at the University of Hawaii Cancer Center, we have a DEXA scanner, which which we do at the baseline and after 3 months and annually. And that's to look at the body fat distribution, water weight, as well as muscle mass. And so if you're interested in that, the information is listed there in the bottom For the cancer survivor, for any cancer survivor at any time, it's Cherie, and the number is listed there. And then if you wanted to do the body composition aspect for breast cancer patients within 2 years of diagnosis, then it would be Alana, and the number's there. And so I'll leave that information with Joanne if you have any other questions about that. The last slide is actually my references, because there's a lot of information outside on the web and in other websites which I wanted to provide for you. So that's the very last slide. And I'm happy to take any questions. Thank you.
Okay, thanks so much, Dr. Fukui. We actually have a raised hand from one of the participants. So Celeste, I'm going to be handing you the mic, and you should receive like a pop-up notification to accept coming onto stage. So here we go. Hi, Celeste. Did you have a question?
Yes. Is this the right way to, sorry, I came in a little late. I don't know if
no worries.
Okay. So I had a question, actually two questions for Dr. Fukui. So if I have a history of pre-diabetes and gestational diabetes already, would you recommend going on, in addition to all of the exercise and dietary advice that you had provided, do you recommend starting on like metformin or something, since I'm at higher risk with my history of breast cancer?
That's a really good question, actually, and I think it's good that your provider has been following that for you. Because of the risk of having gestational diabetes, it does put you at risk lifelong for developing diabetes, but exercise and diet in and of itself can be enough. So we often will tell people, go ahead and try, a good exercise routine and monitor your diet and adjust that. And often people don't have to go on medication. So I would encourage you to, if you don't already, to be part of a exercise program. And then of course, to focus on the diet that I mentioned before.
Okay, thank you. And sorry, I had one more question.
Sure.
I know you probably hear this a lot, but the tamoxifen and the weight gain, with doing rigorous exercise and being very strict on diet, it's like I can drink water and gain 5 pounds that day. Is there anything else outside of exercise and diet that might help with the weight gain due to the tamoxifen and Zoladex?
So unfortunately, that is a very common thing. These are medications we use to reduce the risk of recurrence of breast cancer. So they are important to take. We know that it changes the metabolism in some way. We don't completely understand why. Our best defense against weight gain would be the diet and exercise, which we talked about before. But there are other things that might also be useful, and that is stress management. And I don't think that gets emphasized enough. We have very stressful lives. We live very quick lives. We don't have a lot of time to really take it in. And I think that's actually one way where we can start to gain weight unknowingly. We saw it with COVID pandemic. A lot of people were just more at home. They weren't interacting as much. So there was a lot of other issues with increase in anxiety and depression. And so we do know that that can happen also with these medications. So adjusting for those and making sure that your stress level is as low as you possibly can is also a good way, and to manage any other kinds of stressors or anxieties. We do have some research studies looking at mindfulness meditation for people with anxiety who are cancer survivors. And so that's also something that Joanne can give you information about. We have a researcher at the University of Hawaii Cancer Center who is a clinical psychologist who works closely with cancer survivors. So that might be another way that could be helpful, but unfortunately we do know those drugs can cause those side effects. So
thank you.
Thank you for your questions, Celeste. And the mindful meditation research studies that Dr. Fukui just mentioned, they're on our Instagram and Facebook actually, but we'll also share it after the event. We have a couple more questions. So we will ask this one. Christine is wondering if yoga is good for everyday exercise.
Absolutely. Yoga can be rigorous. It's good for stretching, for centering, for breathing. I think it's a very good way, especially to start out your day or end your day, or even take a little bit of break. There are different kinds. There are ones that are more focused on stretching and core, and there are some that are more rigorous. So you want to balance. You want to, again, make sure you're having the 30 minutes a day of getting some rigorous activity. So that's getting your heart rate up and sweating. Be a little bit more winded when you're talking. So those are good signs that your heart rate is up and you're actually getting that cardiac physical activity. So if the yoga incorporates that, then yes, I do think that's an important part of physical activity every day.
Great, thank you. And you touched on this a little bit, but this person is just wondering if there are any recommendations on returning to healthier routine after, their normal routine has been disturbed by.
Absolutely. And I think a lot of people I've talked to have struggled with this during this time, and myself as well. I used to go into a center to have yoga 3 times a week, and I wasn't able to do that. And I think it's really incorporating that into your lifestyle at home as much as possible. There's some YouTube videos that are free that I had told people about. There's a lot of exercise classes as well. And a lot of the physical fitness places are starting to open again. I think it's always important to have a schedule. So even though you say, okay, I want to do this, you actually have to do it. And it takes about 2 weeks to establish a routine, which seems like a long time, but think of it like anything else. You shower every day. Well, not all of us did during the pandemic, but you brush your teeth, so there's certain routines that you wouldn't skip. So the same thing with exercise. You're not going to skip that because that's part of your routine. It's part of living a healthy life.
Great. Thank you, Dr. Fukui. So we actually had a couple of questions that came in through social media as well, so I want to make sure we answer them here. But the question is, so if somebody is going through treatment right now, going through active treatment like chemotherapy or radiation therapy, do these exercise guidelines still, are they still applicable?
Great question. So these guidelines were actually established for cancer survivors. And in general for health. We do have to make modifications, of course, because we know that certain treatments can affect someone's physical ability. However, we know it's really important to stay active while you're undergoing chemotherapy, radiation, post-surgery. And so the exercise study that I mentioned before at the Rehab Hospital of Pacific, they actually will do a testing before to see where you are within your maximal heart rate. And they figure out a whole program for you. So it's tailored and it's specific for cancer participants. So they know people who might be undergoing chemotherapy, and so they won't push it a certain way. So I think it's important if you are undergoing treatment to have something of a more tailored program for you. If you're able to participate in that free program at the Rehab Hospital of Pacific, I'd say that's a great way to do it. And use your judgment. So if you feel more winded, you're feeling dizzy, you're feeling like you're having some chest pain, go ahead and stop, take a breather. You want to be able to stay active, but not push yourself so much because the body is already going through a lot while undergoing treatment. I would say walking is probably the best thing to do. Make sure you're in a very temperature controlled environment. So you can do it in the morning or in the evenings where it's not as hot. But if you are going to be outside, make sure you have plenty of fluids so you stay hydrated. Otherwise, indoors in like a mall setting where there's a lot of AC.
Thank you. That's really good advice. I believe Windward Mall and Kahala Mall are indoor and AC. Thank you very much, Dr. Fukui, for your time today. We really appreciate it and hope to see you at another event.
Sounds good. Take care, everyone.
Thank you.